Sepida asks, what do you think about flax seeds?
So flax seeds, issue with flax seed is not all of us can convert it to an active omega-3. Some of us are lacking the enzyme to convert flax seed. So it wouldn't be the best choice.
Okay, Margaret asked, what about iodine deficiencies?
So iodine is important too because we don't have it in our salt anymore, and iodine plays a key role for our thyroid. So usually I put a drop of iodine in my patient's wrist, and if I tell them if it stays with them till tomorrow, that means they have enough iodine, which I haven't had one patient who I did the test for the past 6 years who had the iodine. So I know a lot of people are deficient in iodine, but I didn't want to talk about too many supplements. But iodine, I believe we all should take. I myself do iodine drops. It's important for many reasons. Iodine has antiviral benefits. Iodine plays a key role for our thyroid. Iodine plays a key role for converting estrogen to a good form. So, and it's very good for us. I think we should take iodine supplements.
And then Diana asks, any advice for Hashimoto's, PCOS, and parathyroid?
So Hashimoto's, one of the key things with Hashimoto, I've been reversing a lot of my patients who were diagnosed with Hashimoto, which is an autoimmune disease. If you guys, some of you out there may not know, it's your body is attacking your thyroid. It's usually 3 reasons. Number 1 reason is gluten sensitivity. So I have most of my patients get off of gluten. That's the first thing I do with my patient. I usually put them on a cleanse off of the food that causes allergies, off of gluten, off of dairy, and I usually see improvement there in antibodies. If that didn't help, next thing is Epstein-Barr virus. You probably don't know if you even have Epstein-Barr virus. You can't remember if you got it as a child. So you could do the antibodies and see if you've been exposed to it in past. Even though you've been exposed to it, you have the antibody, it still can affect that cellular level. It still can cause autoimmune, chronic fatigue, all that. So I do give my patient natural herbal treatment for Epstein-Barr. And the third thing is parasite, which unfortunately a lot of us do have parasite infection and we are not even aware of it. One of the simplest way to know is during full moon. If you cannot sleep, if you have issue, that means that's when parasite do have cycles and they reproduce. Usually patients who are infected with parasite cannot sleep. And I always tell patients, do you have pets? Number 1 reason is when you have pets, most likely you do have parasite. And if you eat sushi, there is another reason. And if you eat pork, another reason. And low stomach acid. A lot of us have low stomach acid and we don't have that barrier in our stomach because we take a lot of antacid. Your doctor says, take this Protonix or this Zantac antacid. But then what happens? What's the purpose of that acid in your stomach? To be a barrier, so parasite and H. pylori bacteria won't cross. But a lot of us don't have enough acid because of all these antacid intake. So you want to make sure take HCl so you have that barrier, so you don't have parasite. You don't get parasite. And another reason, the way you could find out, is cyst. Usually cyst in the liver or other organs, not ovary or breast. Ovary and breast is hormonal imbalance, and I'm usually able to reverse those. But I'm talking about liver cyst. Usually it's indicative of parasite. So I've been giving my patient parasite medication. I've been shrinking the cysts and been getting rid of them. So.
Okay. Margaret asked, are PEOs a preferred source of EFAs?
Yeah. PEOs, parental essential oil, there's a great book out there that is talking about omega-3 and omega-6s and omega-9s. They are a good source of omega fatty acids, but they're a little bit pricey. Not everyone can afford them, but yes, they are.
Cynthia asked, how do I amp up my immune system?
That's a hard one. It's not a hard one, but it's not easiest answer because it's so many different stuff it's related to. Number one, I mean, I was going to talk about these stuff in future, but just very, I mean, number one is if you have viruses, if you have parasite, if you have autoimmune, if you have food allergies, all these can suppress your immune system. So I usually check viruses, I check the Nagelase level on my patient to see if their immune system is suppressed. I do natural killer cell to make sure they're good. And then vitamin nutritional deficiency, I do that vitamin test to make sure that you don't have any vitamin deficiency, which plays a key role in our white blood cell immune system. Both vitamin C, for example, or white blood cells, they have a lot of vitamin C inside them. And then also vitamin D3 plays a key role in our immune system. It's really, I will have a talk in future about how to boost our immune system.
Okay. What is good for parasites?
So what is good for parasite? It depends really what you have. That's what I learned from practice. I mean, I used to give artemisinin, super artemisia, or I would have them go to one of the chiropractor to check for natural herbal stuff. But then I learned throughout the years, after 3 years, some of my patients taking all these natural, they still would have parasite, that you actually do need the medication. So, and like albendazole, praziquantel, all this kind of parasite medication, it's easier to get rid of them. Issue with parasite is first you have to figure out what kind you have. Do you have liver fluke? Do you have roundworm, tapeworm? The problem is they're not going to come out of you. They're stuck in your organs. You're going to go, even if you do coffee enemas or colon, sometimes you can't see those because they're stuck in the tissue and they're sucking your iron. So a lot of patients with parasite infection, they've been having chronically low ferritin level even. And you could, in some cases, you could see their eosinophil be pretty high. So in terms of parasite, there is different way. We have biomeridian testing, which checks acupuncture point to figure out what kind you have. And I have a chiropractor, or you could also do garlic enemas. Garlic enemas sometimes can help you to get rid of them, and eating raw garlic. Usually I have a recipe for garlic enema for my patient, which I could put it in my website so you guys could see it at Doctor Bita Badakhshan.com. I will load that handout for you for garlic enema, which I actually came up with, and I had a great success for my patients. They've been doing it and they actually been seeing parasite coming out. So they do it a few days before full moon when the parasites are active. But the problem is if you go to a regular doctor, they say here, which I used to do 5 years ago, 6 years ago, here they do the stool test for parasite and ova. 99% of the time they're negative, because parasites also have an enzyme that they break themselves down. I have patients actually send in the parasite that they saw in their stool coming out after enema, and they send it and it still came negative because that by the time the lab had it, it's digested, it's gone. So it's really hard to see parasite. In India, Indian doctor, they actually check the patient's stool within 30 minutes after defecation. So they, under microscope, very quickly they see it. So anyways, one more question, I think.
Yeah, Diana asked, does high parathyroid blood normally mean kidney disease?
High parathyroid, I mean, not necessarily. It could be other causes. You want to do the calcium, vitamin D. You want to make sure you don't have any viral or any kind of infection that can affect your parathyroid hormone. So you do need a workup. That not necessarily kidney disease, but most of the cases it is. I hope I answered all your questions, guys. Thank you for joining me tonight and listening. And in future, whenever I'm going to have a video, or it will be on my website at drbitabadakhshan.com. Thank you. Bye.